Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visa liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. I've been treating gynecomastia for close to 20 years, and I've seen a wide range of patients with gynecomastia due to various etiology or what we call causative factors. One of the main important factors that's causing gynecomastia in certain group of patients is due to anabolic steroids or intake of hormones. These group of patients are often the bodybuilders, athletes, models, or even men who are actually taking supplements or taking medications to help them build muscle or to reshape their body. As we know that the intake of steroids or hormones does affect our hormonal imbalance. One of the side effects or complications of intake of steroids is the enlargement of breast glands, leading to what we call gynecomastia. So what is anabolic steroids? Anabolic steroids are man-made hormones that mimic the male sex hormones. They are either testosterone or testosterone-like substances. The intake of testosterone or testosterone-like hormone will raise the level of testosterone in your body and indirectly causing imbalance of hormone. The interesting part is testosterone itself doesn't directly cause gynecomastia. It is the imbalance of hormone where estrogen level become too high relative to testosterone that leads to breast tissue growth. Then you might ask, how does intake of testosterone lead to an increase in estrogen level? Well, this can happen when testosterone is converted to estrogen by an enzyme we call aromatase enzyme. When the level of testosterone is increased, your body will actively convert the excess testosterone to estrogen, leading to an increased level of estrogen, which will stimulate the growth of breast tissue. Any increase in testosterone, whether a synthetic oral intake or due to organic, physiological, or even medical illness, will lead to a conversion by our body to estrogen, and that leads to gynecomastia. The effects of anabolic steroids not only will lead to an enlargement of breast glands, such as gynecomastia, but it also has various side effects and complications, such as mood swing, sleep disorders, irritability, aggression, acne, testicular atrophy, infertility, erectile dysfunction, prostate issue, balding, so on and so forth. For women who uses anabolic steroids, they may experience amenorrhea, irregular menstrual cycles, breast atrophy, voice changes, growing of excess hair, and abnormal enlargements of clitoris. So as you can see, there are many issues involving synthetic use of anabolic steroids. And it's best to consult your doctor if you have consumed anabolic steroids and you develop certain symptoms from it. For bodybuilders and those who regularly uses anabolic steroids for muscle building and body shaping, the prolonged use of anabolic steroids can lead to reduced drug efficacy and potentially causing the body to completely cease its own testosterone production, and hence it leads to testicular atrophy, erectile dysfunction, and so on and so forth. They tend to adapt what we call steroid cycling, where the drugs are used for a set duration, discontinue, and then reintroduce again. Another prevalent strategy used by bodybuilders is what we call steroid stacking. It involves combination of multiple steroid uses to enhance their overall effectiveness. The continued anabolic steroid use is recognized as the primary factor in the development of enlarged male breasts, and thus how the phrase bodybuilders gynecomastia was coined. The side effects and complications of prolonged or sustained use of anabolic steroids are sometimes irreversible. For example, any changes due to testicular atrophy, gynecomastia, organ damage cannot be reversed even though one stopped using the steroids. When we see patients with gynecomastia due to steroid usage, they may have stopped using the steroids for years and the condition will persist. So often I tell the patients that the only solution for them is to have corrective surgery. Thank you for listening. If you have any questions, just email us. See you again.